Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. HIV, AIDS, and infections. Introduction. Having HIV/AIDS weakens your body's immune system. Your immune system normally fights germs that enter your body. When HIV/AIDS makes it weak, it cannot fight germs well. A weak immune system can lead to serious infections that do not often affect healthy people. These are called opportunistic infections. This program explains AIDS and infections. It discusses common opportunistic infections and their complications. It also includes information on how to prevent these infections. HIV/AIDS. HIV stands for human immunodeficiency virus. HIV kills or damages the body's immune system cells. This destroys the body's ability to fight off infections. AIDS stands for acquired immunodeficiency syndrome. It is the most advanced stage of infection with HIV. The first signs of HIV infection may be swollen glands and flu-like symptoms. These may come and go a month or two after infection. Severe symptoms may not appear until months or years later. People who have AIDS have a weak immune system, and their bodies cannot fight off disease very well. Early signs include extreme tiredness and fever. During later stages of AIDS, pneumonia or cancer may develop, which can ultimately lead to death. There is no cure for HIV/AIDS, but there are many medicines available to treat symptoms. These medicines fight both HIV and associated conditions. Millions of people worldwide live with HIV. Thanks to better treatments, people with HIV are now living longer and with a better quality of life than ever before. Opportunistic infections. People with healthy immune systems can be exposed to certain viruses, bacteria, or parasites and recover, but people living with HIV/AIDS can face serious health threats. Infections that only happen in people with weak immune systems are known as opportunistic infections. These infections are called opportunistic because they take advantage of your weakened immune system. Opportunistic infections can cause serious illnesses. They are the most common cause of death for people with HIV/AIDS. There are different types of opportunistic infections. They can be localized, meaning they affect only one part of the body; systemic or disseminated, meaning they spread to other parts of the body and other body systems. Having HIV/AIDS can make any infection harder to treat. People with AIDS are also more likely to suffer complications of common illnesses such as the flu. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Common opportunistic infections. There are many types of opportunistic infections. Whether and when you become susceptible to them is often related to your CD4 count. In general, people with CD4 counts greater than 500 cells per millimeter cube are not at risk for them. For people with CD4 counts around or less than 500, the daily fluctuations in CD4 cell levels can leave them vulnerable to minor infections. Infections common in people with HIV/AIDS are candidiasis, also known as thrush, cryptococcal meningitis, cryptosporidiosis, cytomegalovirus or CMV, salmonellosis, toxoplasmosis, tuberculosis or TB. Certain cancers are common in people with HIV/AIDS. These include Kaposi's sarcoma or KS, lymphomas. Complications of common opportunistic infections include kidney disease, neurological complications, Wasting syndrome. The kidneys remove waste products and extra water, which become urine. Kidney disease may leave kidneys unable to remove wastes. Although AIDS does not infect the nerve cells, it can still cause neurological symptoms. These may include anxiety, confusion, depression, trouble walking or remembering things. AIDS dementia complex is another complication of AIDS that causes problems with thinking and behavior. Wasting syndrome is a loss of at least 10% of a person's body weight. It is often accompanied by diarrhea, chronic weakness, and fever. Preventing infections. You can help prevent opportunistic infections by taking your HIV/AIDS medicines. One of the goals of HIV treatment is to lower your risk of getting an infection. Antiretroviral therapy, or ART, can help by increasing your number of CD4 cells. This will help protect you. Antiretroviral therapy is the use of medicines to reduce the amount of HIV virus in your body. The amount of HIV virus in the blood is called the viral load. The goal is to lower the virus to a level that can no longer be detected with blood tests. This is known as an undetectable viral load. Your healthcare provider may also recommend that you take certain medicines to prevent disease from happening. This is known as prophylaxis. Contact your healthcare provider if you experience symptoms of an illness and you are unsure of your CD4 count. You have had an opportunistic infection before. Your symptoms worsen instead of improving over time. Certain healthy lifestyle habits can help you boost your immune system and prevent infections. Abstain from sex or practice safe sex. Use condoms or dental dams during vaginal, anal, or oral sex. Some people may not need to use condoms if their viral load is undetectable. Ask your healthcare provider for more details. Wash your hands well and often. Maintain a healthy weight and healthy eating habits. When combined with an appropriate exercise routine, this type of lifestyle may help prevent other health problems. Having good nutrition means eating the right types of foods in the right amounts. It is especially important for someone who is HIV positive to eat a nutritious diet. This can support the body's immune system and overall health. Your immune system needs energy to fight off infections. You may need to eat more food than you used to in order to get the calories you need for your body to do its job. If you are underweight or have advanced HIV disease or other infections, try including more protein in your diet. You may also benefit from extra calories from carbohydrates and fats. People with HIV need extra vitamins and minerals to help repair and heal cells that have been damaged. Your healthcare provider may recommend a vitamin and mineral supplement. If you are living with HIV/AIDS, it is important to discuss an exercise routine with your healthcare provider before you begin. Together, you can develop an exercise routine that is right for you and your HIV care plan. Smoking a substance of any kind irritates your lungs. Smoking may increase your risk for serious lung infections. Recreational drugs, such as cocaine or methamphetamine, can leave your body dehydrated and exhausted. They can also lead to skin irritation. All of these things can make it easier for you to get infections. People with HIV/AIDS are at increased risk of severe illness from COVID-19. If you are living with HIV, you should take all COVID-19 precautions, including getting vaccinated and wearing a well-fitted mask to protect yourself and others from COVID-19. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. Having HIV/AIDS weakens your body's immune system. Your immune system normally fights germs that enter your body. When HIV/AIDS makes it weak, it cannot fight germs well. A weak immune system can lead to serious infections that do not often affect healthy people. These are called opportunistic infections. They can cause serious illnesses. They are the most common cause of death for people with HIV/AIDS. There are many types of opportunistic infections. Whether and when you become susceptible to them is often related to your CD4 count. In general, people with CD4 counts greater than 500 cells per millimeter cube are not at risk for these infections. You can help prevent opportunistic infections by taking your HIV/AIDS medicines. One of the goals of HIV treatment is to lower your risk of getting infections. Antiretroviral therapy can help by increasing your number of CD4 cells, which will help protect you. Maintain a healthy weight and healthy eating habits. When combined with an appropriate exercise routine, this type of lifestyle may help prevent other health problems. Thank you for using Explain.